KHON2 News at 5 with Howard Dashevsky and Bridget Namata.
Welcome back, everybody, and thanks for joining us on this Aloha Friday. Americans will soon have a third COVID vaccine option once again.
The CDC voted today to resume the use of the Johnson & Johnson vaccine. It was put on hold in the U.S. after 6 women developed severe blood clots. Health officials say they still have confidence in Johnson & Johnson, and the one-shot option is drawing in folks who wouldn't otherwise get vaccinated.
There's plenty of people who are interested in the J&J vaccine, if just for convenience, as well as for a single-dose option.
Health officials here say they are unaware of any Hawaii residents experiencing any adverse side effects with the Johnson & Johnson vaccine.
But with the shot back in play, Lieutenant Governor Josh Green provided some recommendations on who should consider taking Pfizer or Moderna instead. Nikki Schenfeld tonight with a follow-up.
Hawaii has over 20,000 Johnson & Johnson vaccines sitting in refrigerators waiting to be put in arms. But after the pause, many are wondering if it's safe. The State Department of Health says they'll resume Johnson & Johnson shots soon as the screening form is being updated by the federal government. Officials say consider other vaccines if you're still concerned.
I think that what they're saying is the benefits strongly outweigh the downsides for the Johnson & Johnson going out there. You know, I still as a doctor say be careful. I think that they're saying it's safe. That's fine. I can accept that. But if you had any other serious health conditions or you have concerns, talk to your physician.
Green says the blood clots which occurred in the brain are extremely rare and believes certain people should consider getting Pfizer or Moderna instead.
The kinds of clots though that we see that are routine are women of childbearing age who are on birth control have had historic problems with extra clots, although a different kind of clot. People who have platelet abnormalities, women who are smokers have had extra clots.
He says people with any rare blood disorder should also talk to a doctor first before getting any of the vaccines. The pause in the vaccine did lead to more vaccine hesitancy nationwide, but health officials say the risk of catching COVID or any of the variants is much greater. The Department of Health reported a total of 555 variants statewide today, including a new variant of concern, the P1 or Brazil variant.
The New England Journal of Medicine reported on Wednesday that based on the latest trials done by the Johnson & Johnson vaccine, it is equally as effective against the Brazil virus and the South African virus.
We're still waiting on a date from the State Health Department on when the one-shot vaccine will resume here. Nikki Schenfeld, KHON2 News, working for Hawaii.
To date, more than